average for this time of the year.
All right, Sam, thank you. A lot of athletes put their bodies to the limit every time they step out onto the field or the court or the fairway. For them, sports medicine is the key to staying healthy and injury-free. And here today to talk about sports medicine and the importance of this specialty for athletes is family and sports medicine specialist with Hartford Healthcare Medical Group, Dr. Wei Li. Doctor, thank you for being with us today.
How's it going? Thanks for having me.
All right, listen, first talk to us about what sports medicine specialists do.
Okay. So, aside from us taking care of athletes, we treat everyday active individuals, the weekend warriors, anybody who's just active at a baseline. An easy way to think about us, you can think about us as what we call non-operative orthopedic doctors. We assess and treat all parts of the body, so patients don't have to see multiple specialists if they have multiple areas of pain. We also manage and treat sports concussions, where we closely monitor and direct treatment for our patients and athletes until they make a full recovery before they can return back to sports.
Why is it so important for athletes to get this kind of treatment, sports medicine?
Yeah, so, as sports medicine physicians, we have a comprehensive understanding of what we call functional anatomy, which just basically means how the body moves and how different sports kind of impact it. So thus, when we can see a patient, we can quickly hone in, get the right diagnosis of what particular sport caused what injury, and get the athlete on a correct treatment plan and path without any delays.
All right, listen, since it's Travelers Tournament this week, tell us about the benefits of sports medicine specifically for golfers.
So, a lot of people might think golf may be a less demanding sport physically, but there is actually a lot of repetitive motion from the swing, and this can lead to a lot of chronic tendinopathies and injuries in the hands, elbows, and shoulders. And what a lot of people don't forget is actually the lower back. So we as sports medicine doctors, along with our sports therapists, we focus on teaching something called multi-directional movement with an emphasis on core strengthening, which is an integral part of golf performance.
What are some of the common injuries that you see and deal with, and what are some of the standard practices for treating those kind of sports injuries?
So, the most common type of sports injuries are usually from repetitive overuse injuries, commonly known as like tendinopathies, such as, I'm sure you've heard of these, tennis elbow, golfer's elbows, jumper's knees, and they're all related to different tendons of the body. And, most of them from repetitive motion, as I mentioned, such as, in tennis when you're swinging a racket or when you're swinging a golf club. And the first and foremost with the longest benefit for treating these injuries is physical therapy. So we work closely with our sports therapists to kind of help guide rehab programs, and to get these athletes kind of back into the game, so to speak. From our perspective, we also do injection-based treatments in the office, such as trigger points, cortisone injection, and sometimes even PRP, to help reduce these inflammations, local muscle spasms, to kind of help athletes through the pain so they can participate more in the therapy programs.
All right. As far as preventing injuries like this, look, I'm not much of an athlete, but the old rule used to be to stretch out. Is that still the best way to avoid?
So, actually, one of the key things I want to get out today is actually, before we were all told, stretch before you exercise. We were all told this growing up. New data have shown that that's actually causing more injuries than not. So the proper way to do it is having a good warm-up, something called a dynamic warm-up now, which just, includes a lot of body weight squats, jogging in place, jumping jacks, lunges, anything to really get your body warmed and primed for exercise. And you want to actually save stretching for later after the exercise and activity. And a good metaphor I always like to use is like a cold rubber band. If you cold rubber band, when you pull it, it breaks. Versus if it's warmed up when you play, it just stretches.
Good tip. All right. Dr. Wei Li, Sports and Family Medicine with Hartford Healthcare Group. We appreciate your time today. Thank you.
Thank you for having me.
All right.